everywhere you go.
Live from digital address GA0993341. Hello, good afternoon, and welcome to the Midday News.
Our COVID-19 treatment centers have gone from having 0 patients to now being 4. Ghana Health Service is recording on the average 200 new cases of COVID infections daily.
This bulletin is live on Joy 99.7 FM here in Accra. It's also live on Love 99.5 FM in Kumasi, affiliates across Ghana, including Kaleo FM, Akachi, Dreams FM, and A1 Radio in Bolgatanga. Around the world, we are live on myjoyonline.com. In this edition, Ghana Health Service confirms the infection has now spread to all 16 regions of the country, with more than half of all new cases now with symptoms.
So in January 21st, 22nd alone, we have confirmed 646 new cases from 17 districts and 8 regions. For what we have, about 32%, the number of people who are fallen sick here are much higher than before.
We'll also hear from Information Minister Designate, who says the country may be heading for tightest restrictions in a possible lockdown as COVID-19 cases surge.
If it keeps going the way it is going, I think as the President himself articulated, then we are heading for some more restrictions. And if it means reviewing some of the legal instruments.
Meanwhile, government is stepping up its response, including contact deployment of contract tracers and new isolation centers.
But I want to give a warning here. I don't speak to this beefed up bed space to encourage you to more or less act funny and be reckless. The good news I continue to say is that in terms of transmission, the virus hasn't changed its way. Keep your mask on.
We have more on that also as the country bids farewell to late former President Rawlings. His schoolmates, military and political colleagues share memories of the man described by his peers as an enigma.
Anytime the bigger children will try and bully me, I always tell them, I'll tell Jerry, and immediately they stop. He never knew that was what I was doing, but I was using his name to protect myself.
He had a particular way of walking with his legs very wide apart.
But what were some of his food choices?
When President Rawlings is if you call him, he wouldn't mind you. And then when he was eating, he asked, who prepared the stew? Chief, my skin is fair, but I'm not bony. When I'm making my stew, let the pepper be hot for a black man, not for a white man.
Details of that and 2 witnesses ready to testify. A request to hold proceedings in a counter request that the petition hearing must continue.
Our questions are designed to find out in actual fact what happened. We have filed for stay of proceedings.
I'll tell you what to expect this week as the Supreme Court resumes hearing of the John Mahama election petition. In sports,
Chelsea are set to appoint a new manager following the sacking of Frank Lampard. I'll tell you who is in line for the job when I join you with sports in 20 minutes.
Can't wait for that. That and more here on the Midday News with me, Emefa Apau. Thanks for making time to be with us. We are your home of independent, fearless and credible journalism. Please stay for details. And this afternoon, the Ghana Health Service has confirmed that the COVID-19 virus has now spread to all 16 regions of the country, with Greater Accra, Ashanti and Western regions the biggest hotspot. In the latest update issued a while ago, the Ghana Health Service says as many as 695 were recorded on the 21st of January alone, increasing the active cases from 3,286 to 3,525 and a total case count of 61,498. Director General of the Ghana Health Service, Dr. Patrick Kumabwaje, has been addressing the media on the country's current situation.
The positivity rate for the airport continues to rise. That is, if you look at January alone, is the cumulative positivity at 0.75. But if you take the month by month, you can see there's an increasing trend in the positivity rate. I think the country of departure still remains Nigeria, USA, and the UK, forming the bulk of the people who are testing positive out there. The flights of Araba cases, about 88%. Incidentally, we have African world, which is in the sub-region, coming up. And incidentally, there's also an increasing number of positive cases in the sub-region. And there's a whole ECOWAS sub-region are having a surge, not just Ghana. And so we are also picking up a lot of cases from as they bring in from the West Coast. Of course, BA, KLM, in that order. So what do we really need to do? Even though we have not demonstrated the variant, the new variant, that's the South African and the UK one, within our community set, which we are still doing. As you know, when we isolated people at the airport who tested positive, we found cases of the UK variant and a case of the South African variant amongst them. The chances are that we may have them, and that may be responsible for the increasing number of spread. But the search will continue to see whether we actually have a community presence of the variant in this country. And we looked at maybe it's a variant that has come to the whole of the West Coast that is actually spreading, especially if you see the number coming from Nigeria into the country and other parts of the world where we have the variants.
That's Dr. Patrick Kumabwaji. He's the Director General of the Ghana Health Service. Now, this morning, the service says it is invoking the full complement of its earlier case management regime, from enhanced contact tracing to mandatory quarantines. Government is hoping to control the current surge in positive cases. Manuel Cranting has just returned from that press conference. He joins me in studio. Well, let's first clear the air on this new cases with symptoms, the symptomatic cases. What exactly was the situation, or what the doctor Patrick Kabwaji said about that?
Well, so MFI, in 2020, all of the cases that came through our health facilities had about 78.1% of them not being symptomatic. So asymptomatic cases were 78.1%, with the symptomatic cases being 21.9%. That has changed in just the 25 days in 2021. You're now having 32% of the cases, 4% of all the cases that are coming through our health facilities are now symptomatic, and with and the word that Dr. Patrick Kumabwaji used was that all these 32.4% of the cases that are coming are sick people, and so they are showing symptoms of the virus.
Okay, so let's talk about the extent of spread. All 16 regions now?
That's correct. All 16 regions. You have a total of 243 districts across the country who have now recorded cases. Well, the cases are concentrated majorly in the Greater Accra region, which has more than 50% of the cases. You have 53.8% of our positive cases in the Greater Accra region. The Ashanti region follows at a distance with 12.4%, and the Western region 6.7%. So these are the areas where you have most of our cases.
Unlike the previous one, this current surge, the number of people who are sick, the proportion of people who are falling sick is significantly high. It's about 32 compared to 21% earlier. But I'm sure there are still people who, because of the way things are going, are not reporting, and they may not have symptoms. But for what we have, about 32% compared to the previous one, even if you use the same system we're using, the number of people who are falling sick here are much higher than before. So in January alone, January 21st, 22nd alone, we have 646 new cases from 17 districts and 8 regions. Kwale, Klote, Ayawaso are the key areas where we are reporting the cases. Ashanti has 37 new cases in 11 districts and Accra Metro. Eastern region has 19 cases in 2 districts. Western region has 16 cases, all in Sekendita Accra. The Upper East has 14 cases.
Well, Manuel, there are also calls for the imposition of restrictions, including lockdowns. Was this addressed at the news conference?
And yes, you remember that most of the experts who have been key in the treatment, or if you like, management of our cases, are recommending that. Kojo Ponkoma responds and says that with the trend that we are currently dealing with, a lockdown, if you like, imposition of newer restrictions are not inevitable.
Yes, there's the possibility of some more restrictions being introduced, but especially as this trend is going, if it continues, then that is exactly where we are heading. We are being reminded that we all need to do the things that we were doing in the beginning that would ensure that this third rise, we can quickly curb it, because the dynamics of this third rise appear to be a bit different from the first two that we had, including the number of people who are falling sick, severe and critical, as we discussed. So, especially if these numbers keep going, average daily new cases of 200, if it keeps rising to 210, 250, then in 5 days you are hitting about 1,000 plus. If it keeps going the way it is going, I think as the President himself articulated, then we're heading for some more restrictions. And if it means reviewing some of the legal instruments.
You heard the Information Minister designate Kojo Oponkroma. Now, commercial transport drivers, hawkers, tricycle operators are simply not adhering to the safety health protocols for COVID-19 despite the increase in cases of the disease. Joy News Upper West correspondent Rafiq Salam reports that very few people in the lorry station are wearing nose masks. Meanwhile, government has also reactivated the coronavirus response teams, including contact tracers. The teams were dissolved when the country's cases started dropping. But former Deputy Health Minister Dr. Bernard Okuboy tells Joy News the new wave has pushed the government to act, indicating a new isolation centre has been created at the Ridge Hospital to cater for persons requiring emergency treatment.
You can't really blame government that much for reducing the intensity of the contact tracing, because our cases went down significantly. It got to a point you had about 300 active cases. Now, if you have 300 people and you are going after their contact, their number will not be the same as when you had, let's say, 900 cases. And our isolation centers, the one at Kaswa became virtually empty. Most of our treatment facilities too were not having cases. So they dissolved the gangs, the medical groups we had. You know, we had to form some COVID teams. We pulled doctors from Kolebu, intensivists, nurses from other places. When it got to the time when they weren't having much cases, they dissolved them. What we've done now is to regroup, to bring them back. University of Ghana Medical Center, Kolebu and Ganyist were the classical treatment centers. As I speak, we have created another treatment center at the Ridge Hospital, has about 16 beds. The Ghana Infectious Disease Center, which was built with private collaboration, had some infrastructure challenges.
The former Deputy Health Minister, Dr. Bernard Okuboy, now management and treatment of COVID-19 is free in public hospital. This is because government has taken out the cost, but the situation is different in private facilities, with some paying close to 50,000 cedis for treatment, or is it 5,000 Ghana cedis for treatment. Pharmacist and fellow with the Center for Democratic Development Ghana, Kwame Sapong-Esiedu, says the cost should be enough warning for Ghanaians to mask up.
In this second wave, most of the facilities have been full, and people are having to use a lot of private facilities. And these private facilities are paid for. I have then had a number of my friends, close friends, and family as well, who unfortunately have also gotten this and have come up with bills as that. I am aware, and I have got receipts for a lady from Turkey as well, who unfortunately came to Ghana and caught the virus. And hear this, and I'll send you the documents later. The total bill over the 3 weeks that they stayed in hospital in Ghana is close to 43,000 Ghana cedis. And
do you have that kind of amount? Up to 50,000 Ghana cedis. If you don't, take that wise decision now and wear your nose mask. In Parliament, the Speaker has announced that only 1/3 of MPs will be made to enter the chamber to participate in parliamentary proceedings. The rest will join via online platforms. Listen to Speaker Alban Bagbing making the announcement.
Because of the COVID, we will be needing about 1/3 of members on the floor. The rest will have to do virtual parliament. You have to be in your offices, observe proceedings, as and when necessary, appear to contribute. But we're not going to allow this kind of sitting again. We are also making preparations, if possible, from next week to make use of the new tent that is provided down there.
That's Speaker Alban Bagbing. Let's join parliamentary correspondent Joseph Opoku-Gakpo ahead of sit-ins tomorrow. So, Joseph, let's talk about the plans in place for the implementation of the announcement made by the Speaker.
It's simple. It's not as if the House is going fully blown when it comes to virtual parliament, but a case where MPs would have to show up, sign on that they've attended to Parliament, and then get into their offices, which is just a few minutes walk away, use the tunnel, which makes it easier for them to get to their offices, and then wait in there, watch proceedings on television, as and when necessary, and they need to make any contribution on any subject, then they can get back into the channel. We gather that leadership has actually been in a conversation with MPs, and a decision is being taken on both sides to select the about 45 MPs on each of the sides who will be present in the chamber when sittings begin, and then the rest would be in the offices and come in as and when necessary.
Okay. Now, briefly, they were taking through COVID testing last week. Do we know the outcome just yet?
The response mainly has been that whatever the feedback is, it's something that's private between the MPs and their medical professionals. But Speaker Bagwin made the point that COVID is very real, and that's why they are rolling out all the necessary measures to ensure MPs are safe.
That's parliamentary correspondent Joseph Opoku Gakpo. This is the Midday News here on Joy 99.7 FM. I'll take you to the Volta region now, where we understand there is a massive demonstration that has hit the town of Ho in protest against the assignment or the reappointment of the Volta Regional Minister, Dr. Archibald Lecha. Fred Kwame Asare joins us on the line with more on this. Fred, give us the details. What exactly are their concerns?
Well, so this group is saying that before the regional minister was nominated in 2017, they realized that they observed that he would not be able to serve in the interest of the party. But then they allowed him to serve, perhaps proved them wrong. However, at the end of his tenure, they were vindicated. This is more reason why they are rejecting him this time around. They mentioned that as of now, he has left the party demoralized in the sense that instead of uniting the party, he has rather decided to use what they mentioned as divide and rule tactics, so that he would have people who would be supporting him, so that he can use that to rule the rest of the party. But then they mentioned that this is not helping the party, and then as of now, the party is demoralized. There is more there's more confusion rather than unity in the party. They also mentioned that the regional minister designate, Dr. Archibald Lecha, failed to help or support them during their campaign activities in 2020. They said they have never seen him take part in campaign activities in the 2020 electioneering. Rather, when the president comes, so that he follows the president around, he speaks on such platforms. But for him to join both regional or constituency executives to embark on campaigns, door-to-door campaigns and stuff like that, he didn't do that.
But in all this, Fred, have we heard from Dr. Archibald Lecha? What has he been saying?
Well, the minister himself has not mentioned anything. He has not spoken to the issue yet, but we are making efforts to get to him by close of day to get his response to what the grassroots are saying.
That's Volta Regional Correspondent Fred Kwame Asare. Our top story so far, Ghana Health Service confirms the infection, that's the COVID-19 infection, is now spread to all 16 regions of the country. And the Information Minister designate says the country may be heading for tighter restrictions and a possible lockdown as the cases surge. When we return from the break, we have sports. There's a lot on Frank Lampard. And also, as the country bids farewell to late former President Rawlings, his schoolmates, military and political colleagues share memories of the man described by his peers as an enigma.
Anytime the bigger children will try and bully me, I always tell them, I'll tell Jerry, and immediately they stop. He never knew that was what I was doing, but I was using his name to protect myself.
He had a particular way of walking with his legs very wide apart.
We have his food choices as well.
When President Rawlings is if you call him, he wouldn't mind you. And then when he was eating, he asked who prepared the stew. Chief, my skin is fair, but I'm not bony. When I'm making my stew, let the pepper be hot for a black man, not for a white man.
This bulletin is live in the Volta region on Jubilee Radio Keta, Volta Premier and Kekali Radio in Ho, Lolonyo FM in Hohoi, Pando FM in Pando, Fafa Radio in Joje, Radio Hogba in Angloga, Klenam Radio Bato, Victory FM Aplao. In the Eastern region, we're on K-Poly Radio in Kofrodia. In the Northern region, we're on Bishara Radio, Radio 123 and Radio Justice in Tamale. And in Savannah region, we're on Inkelege FM in Bole. In the Upper East region, we're live on A1 Radio and Dreams FM in Bogatanga and Radio Fumbese in Fumbese. In Upper West, we're live on Radio Sonmale in Wa, Radio Freed in Nandom, Radio Wa in Wa, and Bolu FM in Bolu. In the Bono East region, we're on Gaskia FM in Techiman. In Bono region, we're on Sky FM and Parrot FM in Sunyai. Central region, we're live on ATL FM in Cape Coast. And in the Western region, we're on Radio Max in Takrady.
Thanks for staying with us here on the Midday News. We've all been waiting for this moment, and it's here. Oreku Ampofo is here with the very latest. Please give us all the gist.
Well, it's been a controversial morning for Chelsea fans as Frank Lampard has been sacked by Chelsea this morning following a dismal slump in form that sees the London club sit 9th in the Premier League table. Now, the players were told not to report to the training ground this morning, but instead convene this afternoon ahead of the management reshuffle. Now, Lampard becomes the 10th manager sacked during the Roman Abramovich era, leading the club to a run of 5 losses in the last 8 league games. Now, German coach Thomas Tuchel is expected to be named as Chelsea's new head coach soon as the 47-year-old, becomes an official announcement. Now, there has been discussions with Tuchel and then the club over the weekend, so he's set to take charge as soon as today and would be in charge of the club when they face Wolves on Wednesday. But let's come back to Ghana, where the Black Satellites will face Tanzania, Gambia, and then Morocco in Group C of the 2021 Africa Under-20 Cup of Nations, which would be staged in Mauritania. Now, Ghana would begin their campaign against Tanzania before facing Morocco in their second game, and the tournament will take off from 14th February to 4th March this year. Black Satellites head coach has been speaking to us, and he believes that they are pretty confident ahead of this tournament, and we'll be getting you that interview much later.
Thank you very much, Oreku Ampofo with sport. Now, he was a nationalist, selfless, incorruptible, and fearless, and also a disciplinarian. As the nation bids farewell to Flight Lieutenant Jerry John Rawlings retired, some of his classmates from Mrs. Sam's School in Achimota say he stood up for the defenseless and became a voice for the voiceless, even at a young age. Listen.
My earliest encounter was at the age of 5 years old. I had been sent to Mrs. Sam's School. Prior to that, I hadn't been to school. Those were the days where you qualified for class 1 by putting your arm around your head. But I didn't meet Jerry the first few days. What happened was that, as children will do, they tend to bully the younger ones. And I can't remember whether it was me or another young girl called Swat. And we're crying. And I remember I heard Jerry Mbaye, or Jerry is coming, And I was wondering who that was. Then all of a sudden, in fact, I was expecting an adult. All of a sudden was this boy who was far taller than the rest of us because the older children were on the other side of the compound. So obviously he had crossed from that side of the compound to where the younger children were. So I was looking up at this boy, and he had this gruff voice, and he was asking, what happened, So the younger children were recounting what happened, and he ticked them off. Of course, I was very quick to learn that lesson.
Now, on June 4, 1979, the late President Rawlings staged his first coup. Some of his military colleagues at the time have shared memories of the event in a documentary put together by the Jerry John Rawlings Foundation.
On 4th of June, there was a massive revolution. Never seen it like this before. Where the young officers of his type, many of them, and other ranks, rebelled against the military government.
In the early hours of the morning, we had some shots in the Burma camp area, and as the day dawned, as morning became clearer, we heard that there was something going on.
All of a sudden, I realized that the firing was getting closer to my residence, which was number 55, Juma Ridge. And there, I heard my name. Somebody shouted my name, "Squadron Leader Dagbe," in loud voice, "Come down. We need you." And there was a fighter plane waiting. And then I was told that, yes, you must fly this airplane. I said, where am I going? He said, no. You just fly over Accra. For what? I said, just go and fly over Accra. This was what I was told.
But beyond the uncompromising face was a man full of humor and never rejected a dish of kinky and fish. Former Chief of Defense Staff, Brigadier General retired Joseph Nunu Mensah tells us more.
Not long ago, I had this wonderful kinky with really good fish, okra, and this stew. And when President Rawlings sees okra kinky, if you call it, he wouldn't mind you. And then when I was eating, he asked, who prepared the stew? I prepared it, but I said, my nephew did it. You want to talk to him? Then I called my nephew. I said, but I only want to talk to you. Then he told this nephew of mine, Chief, you know, my skin is fair, but I'm not bony. When I'm making my stew, let the pepper be hot for a black man, not for a white man.
What's pepper when it's not hot? Well, the final funeral rites for the former president commenced yesterday. Started with a requiem mass and then a vigil, and now he's been laid in state. I'll take you live to the Accra International Conference Center, where Joy News editor Araba Kumsin has been monitoring activities relating to the funeral of the former president. Araba, we're told the body of the late president was conveyed to the center as early as 5 a.m. Beyond the NDC, who are those expected to officially pay their last respects to the late president today?
Well, MFA, earlier today, the top hierarchy of the military, as well as members of the NDC, as you indicated, both the leadership and the grassroots came by to pay their last respect. I mean, the mood here is somber as expected. Many people who troop in to the center emerge with tears in their eyes. And like you indicated, the body came here at 5 a.m., and it was accompanied by his widow, Nana Kunedu Ajiman Rawlings, and their 4 children. They have been sitting in there at the foyer of the Accra International Conference Center, where the body is laid. There's tight security here, dozens of police and military personnel stationed here, and one would have to go through strict COVID-19 protocols to be allowed access into the foyer.
Now, you've been interacting with some key personalities who work closely with Mr. Rawlings. What memories have they been sharing with you?
Well, I spoke with the former National Secretary of the PNDC, Alhaji Hudu Yahya, and former Information Minister, Kofi Totobi Kwache, among many others. Also, the former Finance Minister, Professor Kwesi Boche. They all made the point about the need for probity and accountability to be installed in our governance today. And they also made the point that Mr. Rawlings always looked out for honesty and integrity in selecting the people who worked for him. Mr. Totobi Kwache, he talked to me about how much of a taskmaster President Rawlings was.
That he was a taskmaster. He will set you on the most difficult assignments just to measure you, your ability, your competence. It's a very sad day for the nation. JJ was such a huge figure in our whole political scene. And as I said in my tribute, you know, when a man attains such a huge stature...
I've just entered and seen his lifeless body, and the reality has dawned on me that indeed our former president, the founder of our party, the NDC, and the charismatic leader upon whose vision the party was established, is indeed no more. Indeed, it's a very sad day for me, because President Rawlings was an icon of a leader, virtually a stabilizing factor in the country.
Well, the head of security agencies started with the filing pass. The general public is now allowed from 12 p.m. Today to also go and, file past the body and pay your last respect to the former president, Jerry John Rawlings. And just before we go, EC chairperson Jean Mensah and NPP's Peter McMahon have filed documents indicating their preparedness to testify against John Mahama in the election petition currently at the Supreme Court. Mr. Mahama's side has, however, failed to file any witness statement as they seek to push the Supreme Court to halt its proceedings in what promises to be a week of interesting developments at Ghana's Supreme Court. We look forward to that, and live coverage will be brought to you also on all our platforms. And that's it for the Midday News here on Joy 99.7 FM. There's more news when you log on to myjoyonline.com. I am Emefa Apau. Thanks for your company. Pastor Mensah Tabil has living word. Please stay for it.
Look at you, the big boss.
You know they here.
You know they fear who?
Until somebody says, I will tell your